Good morning. My name is Lisa Lyons. Thank you for taking the time to hear why I believe you should support Senate Bill 2840, the Bipartisan Primary Care and Health Workforce Act, for this 118th Congress. This bill is sponsored by Senator Bernie Sanders, who has a long-standing history in the Senate of supporting healthcare. The co-sponsor is Senator Roger Marshall, who before his political life served as a primary doctor in rural Kansas. There could be no other senators who know the history and needs of the health workforce. It was submitted on September 19th, 2023, and there are 3 sections. Section 1 supports an increased funding for the community health centers across the nation, Health Service Corps, and a teaching health center to establish more primary care physicians. Section 2 supports training for future primary care physicians and nurse practitioners, 2-year RN programs, funding for nurse faculty, dentistry training and faculty, and loan repayment for all of these. Section 3 increases regulations for hospital to reduce healthcare costs for the patients. I live in a highly populated suburban area outside of Seattle, Washington. Even I feel the burden of trying to get an appointment with my primary care provider. Imagine what the wait is for the Americans who live in underserved areas, rural areas, or urban areas with high poverty, crime, and more minority rates. So this bill seeks to address those concerns. 76 million Americans live in areas that need over 13,000 primary care practitioners, and over 60 million Americans live in areas that need over 10,000 dentists. And there is obviously a nurse shortage. I feel it every day. I get texts from my charge nurse asking to see if nursing can come in and work extra. And in the United States, by 2025, there might be a shortage of between 200,000 and 450,000 nurses. And it's also found that U.S. nursing schools are turning away over 65,000 applicants last year. This survey found that the nurse faculty vacancy rate sits at 8%, which is the highest of vacancies since 2023. Although it is notable that over 80% of these vacancies were positions that required a doctoral degree. To add to the healthcare crisis, the hospital costs are rising, and the hospitals are passing that cost on to the consumer. And without price transparency, patients do not know what they are paying for, and they certainly don't know it before the service, so they can make educated choices on their care. So this bill imposes mandates of restricting insurance by contracting terms and limiting the collection of facility fees. That is one of the provisions for curbing hospital costs. And it has been found that hospitals are pricing their services so that revenues are well above the average cost. It is possible that over $200 billion is being transferred from patients to the agencies and activities that are favored by hospital administrators. The proponents of this bill are numerous. One of them is Families USA. They applaud the expansion of community health centers. And those centers their support of underserved clients is well documented, and I have my own positive experiences when I served as a school nurse. They were always the centers that I referred patients to who were undocumented Americans that had language barriers, and they were always ready and very, very helpful to my patients. Families USA also support the actions to improve primary care workforce, and again, strongly in favor of price transparency for hospitals to rein in pricing abuses. This Senate bill is also supported by the Association for Clinicians for the Underserved and by the American Nurses Association. You will not be surprised that an opponent of this bill is the American Hospital Association. The direct cost of this bill during the 2024 to 2023 period would increase spending by $23.1 billion. It would increase revenue by $7 billion, but that does result in a net increase of a deficit, adding to the deficit of $16 billion. But there are also some indirect savings that we will see down the line. A systematic review of 50 studies show that increased primary care access is associated with a significant decrease in hospitalizations and/or emergency department visits. Also, increased primary care is associated with lower rates of preventable hospitalizations, specifically for those over 65 with both Medicare and Medicaid, especially seen with diabetes and congestive heart failure. Some similar bills have been presented, like the Future Advancement of Academic Nursing, Nurse Faculty Shortage Reduction Act, Improving Care and Access to Nurses, and the National Nursing Workforce Center Act. But all of these are stuck in committee, and according to govtrack.us, all have between only 0 to 6% of being enacted. The status of Senate Bill 2840 is current, and it passed out of the Help Committee on December 21st, 2023, and it has been placed on the legislative calendar for the Senate. And it is projected to have a 60% chance of being enacted. Senator Sanders said that despite spending twice as much per capita as any other nation, millions of Americans are unable to access the primary care and dental care they desperately need. And we have a massive shortage of doctors, nurses, dentists, and mental health professionals. With the passage of the bipartisan legislation in the Senate Help Committee, we are beginning to address that crisis, and I'm pleased this legislation passed with a strong bipartisan 14-7 vote. Yes, there were three Republicans who joined the co-sponsor in voting for this bill. In summary, I urge you to vote yes on Senate Bill 2840. We need to act now. Our country is starving for primary care providers and dentists, especially in underserved areas. We desperately need nurses. We need the nurse faculty to teach those nurses, and they need compensatory higher wages to compete with direct care nurses. Hospitals are overcharging, and price transparency is also desperately needed. But going to these great lengths to care for the sick is the ministry of Jesus. It says in Luke that all of those who were sick with various diseases brought them to him, and he placed hands on every one of them and healed them. And it is said in Matthew that Jesus went throughout all Galilee, healing every disease and affliction among the people. Thank you for your attention, and please vote yes on 2840.